Hey, this is SportsSlaw with Lomas Brown, the pro.
And Deb Schneider, I'm the prof. And together, we're the pro and the prof. I got to stop laughing at that.
I know, Dale. This is what episode like 50 something. And every time it comes on, I kind of smile too, because it's like how you said, and I'm the prof.
I laugh at your giggle.
Yeah. Well, you know what, Deb? I'm glad you can make me laugh right now because I was telling you a little earlier, had a death in the family when we had to put our dog Albert down after 14 years. He was just a great dog. He really was. And it's hard, man. Oh my gosh, it is hard losing a pet, and especially a pet that you consider a family member. So RIP to Albert.
Yes. And I'm so sorry. I know you and Wendy, and the kids, 14 years. And it's a long time. Yeah. He was a pretty dog too. He was a pretty dog.
Yeah, he was. Yeah.
Yeah.
Yes,
I like
he was. So,
yep.
So we'll liven things up. How has your week been going? How are things going with you?
It's been going good. Been watching the Olympics.
Yes.
Shout out to all my swimmers and the gymnasts and Simone Biles. Saying mental health. This is such a big deal. We've been talking about it a lot. Yes,
Deb, you were right about that. And I was actually looking at Michael Phelps, who they were interviewing. He was talking about all the things that he went through mentally while he was competing. And, I just think when you look across the board, and if just you look at tennis with Naomi Osaka, her withdrawing from matches, and just across the board, that it is so important. Everybody talk about physical health, but I think mental health needs to be put right up there when you start talking about athletes, not only amateur athletes, but when you talk about professional athletes. I just think the mental aspect of it is so tough on those people.
Well, you've been there, when we've talked about the fact that a lot of athletics is is as much mental as it is physical. And I think with, one of the things I'm going to bring it to our guest here and talk about, we're going back to COVID. And I think that part of all of this, the mental health, we've got Prince Harry, we've got these athletes who are saying it. It's not just athletes. Everybody is suffering right now. There have been a lot of things that we need to deal with. And tonight we're going to talk with Doc R, professor of clinical laboratory science at Texas State.
Friend of the show.
Good afternoon. How are you guys doing?
Good.
Doing great, Doc.
Good.
Really looking forward to joining you guys today to talk about all things vaccination.
Yeah. We're going to talk about vaccination. And Doc R wrote an article, and his co-author, Dr. Ryan McNamara, is with us. He is a research associate of microbiology, immunology. I can't even say it all. Virologist. I told you I'm going to have to make you introduce yourself. But he's with University of North Carolina at Chapel Hill, and currently broadcasting from Boston, one of my favorite cities.
Yes. Well, thank you so much. They're two great cities. I love them both.
Yes. Welcome to the show today, Doc.
Welcome.
Yes.
Docs.
Yeah, docs.
hey, we're a paradox.
That is so bad. I hope you didn't use that on any other show. So let's talk about a little bit about the article that you put together. The last one I've seen, I know you've done a number of them, but really what we're talking about is the vaccination status of America. And we have, and I think someone put it, we have two Americas. We have the vaccinated and the unvaccinated. Most of the vaccinated are not ending up with COVID, or at least they're asymptomatic. They're certainly not ending up in the hospital. with a few breakthrough cases being the exception here and there. They're not dying. And then we have the unvaccinated, where COVID, and especially the Delta variant, is raging pretty much unchecked. Am I correct in saying that?
Well, I'll start off, and then I'd love to hear Ryan's thoughts too, because his background is a little different than mine, because he is more of an immunologist, which is, part of the science world that looks at the immune system. But yeah, you're relatively correct. The Delta variant is covered, and we're protected if you're vaccinated. So, one of the things Ryan and I were mentioning in the article and some other conversations we have is the good news is that if you are vaccinated by any of the approved vaccines, Moderna, Pfizer, or J&J, right now the data is showing that you're relatively safe. There are some breakthrough infections going on. Remember, no vaccine is 100% effective, right? So even at 95 to 90% to 85, whatever numbers you're looking at, that still means it's not perfect coverage, but it's certainly better than 0% coverage. So that's happening with respect to coverage. And then if you're looking at the data across the United States right now, I mean, depending on the data you look at, anywhere from 98 to 99% of all COVID cases, especially those that are ending up in hospitals and even dying, are primarily unvaccinated individuals. So it really has become, as Dr. Fauci mentioned, two Americas. And what we tried to do with our article, Deb and Lomas, was not to walk down any political divide or any judging. It's all about information and education, and trying to get everyone out there who was on the fence, especially, to start knowing that we're about 4 to 6 months in now with vaccines, and they are working. They're absolutely working. They're outstanding vaccines. And, I keep telling people you should be very happy you are living in modern science mRNA vaccine framework, because it's just unbelievable what we're living through. But I'll let Dr. McNamara comment a little bit about the article from his perspective.
So, to build upon what Dr. Rohde was just talking about, we're really talking about the two Americas, the vaccinated and the unvaccinated, and how we're seeing different clinical outcomes in COVID cases. So what we know about the vaccines is that they are incredibly effective at limiting severe cases of COVID-19. And that is really borne out by the hospitalization data that we have been seeing lately out in California and Los Angeles County. There was a time frame there where every patient who was admitted to a county hospital in Los Angeles were unvaccinated. I think it was in the month of June in Maryland, every person in Maryland who died of COVID-19 were unvaccinated. And what we were really trying to bring attention to was that these vaccines, despite new surges, new variants, kind of just a whole bunch of new stuff, they are actually very constant. They're very good. They're doing exactly what they were designed to do, and that is to keep people safe, keep people out of the hospital, keep people out of the ICU, keep people off the ventilator, to just limit any kind of severe COVID-19 after they are exposed to this virus.
Yeah. So and just quickly, so I want to just shift it to the sports. We see where the NFL is making it's a big controversy going on in the NFL, because, I think they said the statistic was maybe, I know it's over 60%, that they could say of most teams or most players aren't vaccinated. And I know with the Lions, I think their percentages are probably about 60% of their guys. A lot of their guys have come out strongly saying that they don't want to take the vaccination. They don't want to do that. That's something that they don't believe in, or for whatever different reasons, they don't want to get vaccinated. So I guess my question to you guys is, since the NFL is the 1,800 healthy professional athletes. Most of them are pretty young, except for Tom Brady. If it spreads, you think they're thinking is if it spreads throughout those guys because they're so young, they're athletic, that it might just pass through. It might be something that may not affect these guys. I'm just trying to get a little understanding of why these guys, like I say, I'm 58, so I can understand the guy in my range. But when you start talking about 20-some-year-old professional athletes, is there a danger if it does spread to a team between those teammates? Is there a danger for something to go wrong? Maybe somebody may be asymptomatic or something may have some type of underlining health problems where it may affect. Why do you think the thinking is like that between the professional athletes, especially the NFL athletes?
Yeah, I'll jump on that real quick. And again, would be interested in hearing Dr. McNamara's thoughts. But Mr. Brady is, he needs to retire. So the Cowboys can do something one of these days. I'm tired of reading about Brady. But,
okay, so we're done with the broadcast now. Brady needs to retire. Thank you, everybody.
Much respect to the GOAT, right? He's amazing. We've talked about this in some of the former shows. It's an interesting thing when you look at strong, in the prime of their life athletes. I think there is something going on there. You could even look at college students in a sense that younger people, tend to be more risk. They don't have an issue with risk, I guess, at least some of them. And so there's always that part of it. And then, they are very healthy. So perhaps there's something going on in their frame of mind that, I'm so healthy that, a mild case of COVID's not going to bother me. And I'm sure Ryan would agree with me that that's possible. We have seen mild cases of COVID in young people and they recover, but we also have seen cases of death. And we've also seen cases of what's being called long haul COVID that has long-term effects. And I keep going back to this when people talk about it. It is a novel virus. We really don't know more than about a year of what's going on with this. And people are still a little confounded with some of the syndromes that we're seeing, whether it's multi-inflammatory system or long haul stuff with brain fog and blood clot involvement and all of these things you've heard about. So, just in my professional and personal opinion, I would never want to take that chance. And so I would hope that the NFL has some opportunity to, through leadership and example, at least encourage and promote vaccination. It may not be possible to mandate it. We shall see. We're seeing more and more mandates come out with corporate world. Apple's done some things. In my area, Austin, Texas, they just 3 of the leading hospital centers just basically mandated vaccination for healthcare workers, which makes sense. But we may see more and that come along. And I think as that comes along, we might see more adoption of that. But we are living in a time of challenging hurdles when it comes to vaccination. So my hope is that people will at least give it some thought. If there's an outbreak in the NFL, Lomas, to come back to your point, it'll be just like any other time. It could be dangerous. You might have some people not problematic. You might have some people in trouble. And what do you start doing as the NFL if you have a massive outbreak in a facility with coaches that are in their 60s and 70s and trainers and other people that are a little more at risk? And what do you do about, interaction with fans and things like that? So there's a lot to deal with if that happens. So, I'm continually hoping that vaccination is something that people will embrace if they have no medical reason not to.
Yeah, I agree with everything that Dr. Rohde just said there. And I would build upon that before COVID, and Dr. Rohde knows this, before COVID, I was an HIV scientist. And the HIV community is at a much higher risk of developing severe COVID, just like any number of communities who are on immunosuppressants, who are immunocompromised. I know that Ron Rivera, the head coach of the Carolina Panthers, he had a recent bout with cancer, and a lot of the drug regimens that we have for chemotherapies intentionally suppress your immune system. And it is up to people whether or not they wish to disclose that. But the reality is that we live in a society that has a lot of immunosuppressed individuals. And they have every right, in my opinion, to expect a healthy workplace. And as far as the sports analogy goes, I'm really glad that you guys are hosting me, because I think football is a great example of how infectious diseases and public health can work. So Lomas can attest that when you run a play, whether you're if you have an offensive guard or an offensive tackle miss a block when your quarterback drops it back to pass, the whole play is busted, right?
Mm-hmm.
If you have a safety who doesn't drop back and take the deepest guy, the opposing team can just put one over the top and score a quick touchdown on you. You need every one of those 11 pieces out there on offense and defense functioning as a cohesive unit in order for your play to succeed. And when it comes to infectious diseases, the same is really true. We need a cooperative team effort here to address a common enemy here. Again, you have Dr. Rohde and I, we didn't really want to get into the red versus blue, any kind of those debates, because the reality is we're all on the same side. We're all against the virus. And as far as young adults, we know that young adults, from the data, young adults being 20s and 30s and 40s, they are actually the demographic that tends to spread the virus the best. They may not have the worst clinical outcomes, but you really look at how the infectious diseases spread, or how COVID has spread, you see that it almost always begins when you have working age adults being brought back into a work environment, into an indoor environment, when they're mixing and intermingling with different contacts, where they're indoors for prolonged periods of time. That is just a perfect storm for a super spreader event. And then they can go off into their homes and into their communities, or travel somewhere else, and then they can take that virus with them. So I think that sports is just a great analogy here, because we need everyone cooperating against one opponent, and that is COVID. And we also need to acknowledge that your decisions can impact your greater community. So a locker room, for example, not everyone who is part of the Dallas Cowboys is in their 20s and 30s, right? I mean, you have custodial staff, you have coaching staff, you have administrative staff. You have so many other people who are part of the greater Dallas Cowboys organizations beyond just the players.
Amen.
Yep. So that came up with all kinds of questions for me. I love the sports analogy. One of the things that I think of, a couple of things from that. One is mutations. My limited biology knowledge tells me that if we've mutated already, as long as we have hosts, and they may be younger, but we're still looking for more mutations. And at that point, I don't know when this ends and what happens with it. Right now, we have the Delta. Where's the epsilon? Where's the gamma? Just keep going with Greek letters or whatever you want. But do you see that happening? And those mutations may actually be worse and may not be affected by the vaccine? Is that a possibility?
Yeah, I mean, I'll jump on this again, and again, be interested to hear Ryan's comments on this. But yeah, kind of general principles of viruses and really other microbes, but viruses are probably the most diabolical at mutating. They're very rapid, especially RNA viruses, which SARS-CoV-2 is. Ryan and I had an article as well about, there will be a SARS-CoV-3 at some point. So they do, but that's a drastic change. But when you have a variant, when you have a viral change that goes through mutations, like we're talking about Delta right now, don't we all have new wonderful vocabulary in the last 14 months? I mean, flattening the curve, Delta variant, mRNA. I mean, people are just learning science left and right. That's probably a positive thing out of this. But yes, I mean, the general thing is that if you don't get enough of the naive host, enough of the population that's not immunized, then you're giving that virus a foothold to change and to adapt and mutate. And it could be really bad. It could be worse than Delta, or it may not be. Sometimes mutations end up and they're lethal to themselves and the virus, dies off. So nature has shown us that over and over. And I think Dr. McNamara would agree with me that, public health history and vaccination history has kind of shown this. We rarely reach herd immunity unless we do it through vaccination. And so we really need to get those percentages up. Right now, I think if you look at America as a whole, and the article talks about this, you can tout numbers like 50, 55%, something like that. And then you can break it apart. You can break it down. And Massachusetts a week ago, was at like 65%. Missouri was like at 40. But even within those states, what we're seeing is micro pandemics, right? I mean, you have county level data that shows some are as low as 15, 17% vaccinated. So, if things don't change, what I think is going to happen this fall and winter is that we're going to start seeing little mini outbreaks of issues at the county level, at the town level. It looks a little better when you look statewide at the data. That happens when you throw all the data together on anything. You start breaking it down, and it's worrisome in some counties. And Ryan can speak a little more to that piece of mutation there.
Yeah, viruses are going to seek out any and every opportunity they can to spread. Viruses really only have two objectives: survive and spread. And they are going to adapt themselves in any way, shape, and form to continue doing their two objectives. What we're seeing right now with the variants is that SARS coronavirus 2 is establishing itself in a new host. We don't know exactly how old SARS coronavirus 2 is. We know that the initial clusters occurred in late 2019, but it's probably been circulating out in the wild for many years. But humans are a very new host for this virus, and it is still tweaking itself to adapt to said host. So right now we are concerned about the Delta variant, which by every objective metric of data that we have is more transmissible. The clinical outcomes appear to be fairly similar to previous variants. That doesn't appear to be more lethal, but it does appear to be more transmissible. And viruses will just seek out any opportunity to become more transmissible, to facilitate its spread. Now, we're very lucky with these vaccines in that they are very durable. They neutralize any and every variant that we have seen with very high effectiveness. As Dr. Rohde previously said, no vaccine is 100% effective, but these ones are pretty darn close to it. The vaccine was designed against a previously circulating variant of SARS coronavirus 2, the original one that emerged out into the human population in late 2019, early 2020. And those vaccines that were designed against that first wave of SARS coronavirus 2 are still remarkably effective against the current iteration of SARS coronavirus 2. There's only so many mutations a virus can take before it basically destroys itself. Yeah. And what I think about these vaccines is that I just don't see a variant emerging that is going to really bypass the protection offered by these vaccines to a degree that we should really be concerned about. Now, we have talked a little bit about boosters, particularly for the immunocompromised, immunosuppressed, and the elderly population, perhaps some boosters that are directly targeting variants of concern that might have a little bit less neutralization. But overall, these vaccines are just remarkably effective.
That's funny.
I think
How's your co-host?
I think your colleague agrees with you there.
Absolutely.
I
So
love that.
for the lawyer here, what repercussions would say, like Doc said, what repercussion would a secretary that works in an NFL office, that works, say for a secretary that's over 50, that works for the Detroit Lions, that may become exposed to this? What repercussion do they have because the players don't want to get vaccinated? Are there any repercussions that they would be able, that she would have if she came down with the virus or came down with the COVID?
I think we're still trying to figure that out, because if you have an unsafe work environment, obviously there's a potential lawsuit or an OSHA violation, depending on what the unsafe environment is. There's also a workers' comp claim, potentially a workers' comp claim with workers' comp insurance. And as of right now, COVID really doesn't hit any of those. And yet we do know, and the Supreme Court's upheld, that some of the universities and some, private institutions can mandate vaccines. And we've seen that in Michigan, obviously, with Dr. Rohde. We've seen that in Texas. We're seeing a lot of especially healthcare systems mandating vaccinations, as well as some of the manufacturers. I mean, and I think that if the NFL wanted to, they probably could. There'd be a huge backlash. But any sports, I think they're a private organization. Why can't they? The big question to me, as I look at all this, is we have, and you talk about the micro, all these micro outbreaks and that. Every state is different. I was looking this up, and I thought I would look up, well, obviously Massachusetts is more immunized than many of the states in the country. Michigan, we've gotten rid of our mask mandate pretty much totally. Texas has gotten rid of the mask mandate and then has said, and the governor has gone so far as saying you can't mandate masks. And the CDC is coming out with other things. And North Carolina is saying, you can have no masks except if you're in a school or your kids and that. How do we reconcile all of this? And that's kind of a question, I think, for all three of you, because it seems to me that it's like any legal thing. When you don't have consistency, everybody's off doing their own thing. How does it affect the youth sports teams as well as the NFL and the teachers? And, there's no consistency. I'm thinking that's a problem. What do you all think?
Yeah, that's the question. That is the question, Deb. I get asked that all the time. My wife, as you guys know, is a pre-K teacher. She literally was sitting out here talking to me earlier before the show about their decisions for the fall, 4-year-olds. So they're even below the K through 12. They're 4. And so they're trying to decide what they're going to do. Should the teachers mask, and, do they mix classes? Do they get to play together on the playground? I mean, these all have different types of repercussions for a lot of people. I mean, in a perfect world, you wish that government and public health agencies could make some common national decisions that people would abide by and follow. It's just challenging in America. What we're famous for, and I think what we're loved for at times, is our independence and our ability to have, self kind of selection of doing things. But when it comes down to disease, I talked about this interestingly with a colleague who's a military veteran, and he actually is not real pro mask and stuff. But you know what he told me? He said, you know what? Just what Ryan was said. It's a common enemy. And when you join the military, you do what's right for your team. And so part of me wants to say that a lot. Like, if you really care about your neighbors and you care about your enemies, for that matter, if you have people that are against, what you're believing, you hope that people would agree on preserving human life and health. And that's what I struggle with personally and professionally. It's a daily struggle. As you guys know, it's challenging. I'm tired, probably as Dr. McNamara is getting questioned about some of these things, and the CDC getting torn down, and I had many great colleagues and friends. I spent time there. It just breaks my heart. These people are public servants dedicating their life to helping people. And it is a tough question, because there just doesn't seem to be an answer. I don't know. It's a struggle.
Yeah, I think someone, and you hit it on the head, I think someone should step up. I think that we need leadership at this point. And if it comes in the point of your commissioners of your different sports leagues, or, working, they have to make a decision. It's not going to always be popular. Believe me, 1,800 guys in the NFL, you're not going to be popular with all those guys, regardless of what you do. But if you look at the greater good of the game, if you look at the totality of the game and the safety of the people that you can protect, especially when you start talking about the secretary that works in the front office, or the custodian that cleans up the practice facility, or the trainer that's a little older, I think they have to be willing to step up and make some tough decisions. And like I said, you're not going to be popular with all the decisions you make. You may have a lawsuit or two that may come out of that, because a player might want to challenge that. But to me, it's certain rules that you have to abide by when you're in the NFL, when you're in the NBA, when you're in hockey or whatever. It's certain rules that you have to abide by. And I don't see this being that. Yeah, it's different. Like you say, it's a different enemy we're fighting, but still, I don't see that being just far off from other rules that the league set. They expect you to be on your best behavior on and off the field. It's a lot of things that they demand out of you. And I don't see why that this shouldn't be mandated, that these players have to get vaccinated if they want to play on an NFL field, on the basketball court, or whatever during the 2021 season. I just don't see the big problem with that, even though we know it is problems with certain people. I just don't see why these commissioners won't come out and take a stand, a tough stand, but take a stand.
Well, I think that you're seeing it increasingly, more private companies, more universities really doing whatever they can to strongly incentivize vaccines towards their population. I agree with Dr. Rohde with what he just said. I fully support what
That's why you two do articles together. You agree?
Yeah, we do. We're two geeks. We're two nerds. We're actually both from Texas, so. But you're absolutely. I mean, the previous point was just absolutely on the head. That I do think that what we can do, whatever we can do to protect ourselves and the people around us, I think we should really take into consideration doing. A lot of us, I have not been able to see my own parents since 2019. And that has not been pleasant. And last summer, I'm calling them probably more than I have ever called them before. So my mom was always thrilled to hear from me. But I mean, they fall, particularly my father, falls into a category of an individual who has pre-existing conditions, who, if exposed to SARS coronavirus 2, could have a very severe case of COVID-19. And I'm a scientist, just like Professor Rohde is, but first and foremost, I'm a son. And I care very deeply about the health and safety of my parents. I care very deeply about the health and safety of my community. It is something I take very seriously. I have known way too many families who have had to see their loved one on the other side of a plexiglass shield in the hospital, or on the other side of a computer screen. There's been way too many people who have had to bury their loved ones over a computer. This pandemic has taken away so many things from us, including the dignity of burial for a lot of the individuals. And I would encourage everybody who is just resistant to vaccines, the mandates are one thing, but I really just encourage people to do this on a voluntary basis, to really consider the people around you, to consider the health and safety of the people around you. You might think that you're really strong, and you might think that you can handle this, but you can't say that for the person who lives down the hallway from you. I have no idea what their health status is. I have no idea if they're HIV positive. I have no idea if they have an individual who's going through chemotherapy right now. Same thing in the NFL or in any sports leagues right now. We, as I just said, Ron Rivera had a very public fight with cancer. And there's a lot more people who have private fights with cancer. They choose not to disclose it. We need to keep all of those people safe. And if you can keep them safe, I would encourage people to do so.
Wow.
Great comments, Ryan. I mean, you really tug at my heartstrings. I mean, it's so true. I've had, just like all of you, I mean, that's the root of it, is that I wished and I hope and I pray that people will consider those types of comments, because I want it to be voluntary too. It's just the right thing to do. It's the golden rule of healthcare. It's the golden rule of humanity, is to protect others and do no harm, and to be part of this society in a sense that you're helping others. So fully agree with Dr. McNamara there. I'm sure you guys do as well, that we want it to be voluntary. I mean, it should be voluntary, and hopefully as we continue down this road, and maybe we see a few more commissioners or a few more corporate bosses or a few more university presidents step into that and just go ahead and do it, that you slowly see all vaccines have had hurdles, even going way back. If you go look at the literature, it's interesting to go all the way back to early vaccination. People were even masked in the pandemic of 1918. You had people coming out against masks. It's an interesting cycle that we continually have, and hopefully we can get past that and come together and celebrate the defeat of this virus in a couple of years, if not sooner. So that's the hope. It's going to be a tough road, I think, but I hope we get there.
Yeah. Now, I know, Dr. McNamara, you need to leave. I think that was a great final thought, and maybe the rest of us can stick around for just a few more minutes, because I have questions.
Absolutely. Well, I'm leaving you in good hands. As well as
Dr.
Rohde.
And we have to get this guy. We have to get this Carolina Blue guy back, right?
That's right. We need him back.
Yeah.
Really looking forward to this year. Hey, preseason, I think we're top 10.
Yes.
Keep an eye on those Tar Heels. Keep an eye on my Tar Heels, okay?
I will. We'll make sure we do
Next time
that.
you're on, I'm wearing my Tar Heels shirt.
There you go.
Oh, I love it. Thank you guys so much.
Thanks, Doc.
Thank you.
Take care.
So, Lomas, I have a question for you. And this is, again, for both of you, I guess. How do we change minds? Lomas, you're an athlete. How do we get these guys? It's a little bit political, because it's a little bit red and it's a little bit blue. It's a little bit old, young. It's a little bit racial. It's a little bit of just about everything. I've heard so many reasons why I'm not getting vaccinated.
Yes.
How do we change the minds of an invincible 25-year-old lineman in the NFL? Or a swimmer in the Olympics? Yes.
And Doctor, this will kind of lead right into you. I just think, and like Deb said, I've heard so many reasons, and probably the number one reason that I've heard is that it was formulated too fast. The antidote was made too fast. They didn't spend enough time on it, or we don't have enough time to see how this is going to affect you later on down the line. I think that's been the number one thing. And like I said, I think what they have to do, and what the NFL and all these leagues have to do, is look at everything in totality. Look at all the people that have been vaccinated, and look at the numbers from that standpoint. Like they say, it used to be the show that said numbers don't lie, and you put the facts in front of these guys. And I think that's what these commissioners have to do. they have to put the hard facts in front of these guys. Where if we've had some people that have had an adverse effect to the antidote, but that's a small number. That number is so small compared to everybody that's been vaccinated and everybody that's doing well with the vaccination. So I just think, guys, athletes understand numbers. They understand statistics because that's part of their game. And I think that has to probably be brought to the forefront, a lot more when you talk to these guys. And also, I think you have to pull on their heartstrings too. I think you have to constantly remind them that it's not about them. It's about your loved ones. It's about people that you're going to be around that may be vulnerable to getting COVID, that may have the adverse effect. So I think it's going to take a combination of both in my mind when you're talking about dealing with these professional athletes. And the last thing I might have to say, and this is going to sound kind of crazy, you might have to motivate them by incentivizing these guys. It might have to be a money thing with some guys. You might have to throw in a bonus for these guys going out and getting vaccinated. I hate to say that because, like you say, Doc, it should be a voluntary thing. It should be something that these guys want to do on their own just because it's the right thing to do. But they might have to even look at trying to incentivize guys going out, just like we got the MNOs right here in Michigan. And I don't know if you guys have it in Texas, Doc, but we have a lottery here that people get entered in. Vaccinated people could get entered in, and you could win up to $1 million in this lottery just by being vaccinated. So I think it's going to take a combination of those things before really, these guys really, it kind of clicks in and they say, okay, this isn't just for me. It's for the people that I love and that the people that I'm going to be around.
Yeah. Another amen. I totally agree. I think, you hope it's voluntary, obviously, but when you look at Texas hasn't done it from a state of Texas type of lottery, but I do see tons of corporate incentives, major grocery chains and major some counties and things like that are doing things like $100 Amazon cards or, a PlayStation or whatever they can throw in there, which is, if that's what it takes, you hate that it has to take that, but if that's what it takes, I'm fine with it. One more shot is one more protected individual. So I think that's part of it. And then if you look at, the other side of that, I don't know if this is going to work. You're kind of seeing it a little bit is the carrot and stick kind of attitude, because, what you're seeing, and even President Biden and his cabinet are talking about, if you're not going to be vaccinated, if you're a federal worker, then you're going to be tested every week. And you're going to mask up. And, ultimately, and again, this isn't a popular statement, but this is what healthcare says. You can find another job, right? I mean, ultimately, if you're going to endanger people around you and you're not going to either do the vaccine or you're not going to be tested so that we can show you're safe to other people, then we may have to relocate you or you may have to find another career path. And that's harsh, right? I do not want to see that. But, some of that may happen. It's definitely happening in healthcare. They're not going to put patient safety at risk. And the other side of that is if you wipe out the healthcare force, you hurt patients. So if you lose, 7 doctors and 50 nurses in a small town, you've lost everybody. I mean, it's a massive problem in small town America. In other countries, you're seeing this where they lose the one physician, in the whole city. So it's something you have to consider, and just hope we don't have to go there completely. I hope with time, and I hope with shows like this and other shows. That's why I love this show and other shows, to kind of talk about stories. We've talked about this before. I've done it with my hair cutter. I've actually helped convince some people to do this that were against it by just having a conversation. And it's not the fastest way, but one-on-one conversations and, leaders like yourself, Lomas, and Deb with your show. everybody is on deck to try to help us get there. And I'm just so excited when you have these types of shows that let us talk about this message.
Yeah. So Doc, is there something that the vaccinated person can do? Are there precautions that, the vaccinated person, you're vaccinated, is there precautions that you can take now to kind of protect yourself from somebody that may not have gotten vaccinated and you just don't know? Are there things that we could do? We know the standard things, 6 feet apart,
Right,
and different things like that, but is there anything else that you could think of that may help?
Yeah, I mean, so that's a kind of a good thing to come back to. Let's talk about, the vaccinated population, because there are some new data out, and it's important data to mention. It's kind of brand new. The CDC director and others have been talking about it this week, and that is, it looks like with the current data that's coming out that if you have a breakthrough infection, so if I have a breakthrough infection, and even if I don't know it, or I'm very mild symptoms, that it is showing that I am going to shed the same amount of virus as an unvaccinated person. That has implications, right? And that's what my wife and I were just talking about, because she's in a classroom of 15 4-year-olds.
Mm-hmm.
And while we think that 4-year-olds are pretty safe, it's not completely safe, right? And how horrible would it be to shed virus and cause some small immunocompromised child that has asthma or something to come down with COVID? So there are implications. And so even if you're vaccinated, you really need to think about this coming school year and this coming year of how you're going to kind of handle things. You're protected. You should be good. If you're outdoors, things are better. But what I've told people, this is me, when I go into a unknown situation, I had jury duty 2 weeks ago, a jury summons. I walked into the courtroom and there was probably 150 jurors that had been called, the judge, the lawyers. There were probably 10 of us with masks on.
Wow.
I'm wearing my mask to protect other people too. I don't know anyone's vaccination status. And if that judge would have said something, or a lawyer would have said something like, everybody's going to be maskless because we need to read your face and see what's going to happen, I probably would have been held in contempt, because I would have said, Deb, to the lawyer, I probably would have said, then show me your vaccination status of every person in this room and I'll take my mask off. So, I was ready to take a stand, but I got excused. But just little things like that. So when I'm in the classroom, when I'm going to meetings with 20, 30 faculty, if they're doing it in a small room, I might suggest we do it by Zoom if I don't know what's going on. And I'm going to try to lead by example. That's what I'm going to try to do. Now, when I'm with family, when I'm with my colleagues and my students that I know are all vaccinated because we're in healthcare, I'm not going to be as concerned. We're going to enjoy each other. We're going to be careful. We're not going to, get right up in each other's faces if we have symptoms, but I'm not going to be as worried. If I'm outside, if I'm eating outdoors, if I'm in outdoor venues, if I'm walking, if I'm exercising, if, all those common sense things are still good. But you still want to kind of think about your neighbor, right? Even if you're vaccinated.
So we're running out of time here, and I have obviously so many more questions.
I know.
Kind of final thoughts on this, like which are we actually going to get sports to say vaccinations are absolutely required? We're not seeing it yet. I don't see it happening, but we had bubbles, any final thoughts?
Yeah, I think this is an unfortunate thing, because I think it happens in the real world too, not just sports. Unfortunately, bad things happen before stuff, sometimes changes.
Yes.
What I worry about is, and I hope I am completely wrong. I always say this, I hope I'm completely wrong, but I absolutely worry about super spreader events. I was watching those Bucks win a couple of weeks ago. I was excited for Giannis and PJ Tucker, former Longhorn, and Bryn Ford, a Spur, to get that ring. But when I looked outside and in that stadium, I was like, oh my God, what happened? What happened?
Yes.
The NBA was a model, the year before, and now we're back to like 50, 60,000 people crammed into the streets. Now they're outdoors, but they're crammed in there. I mean, you wouldn't have caught me out there in that crowd, even if I was a Bucks fan. I just, you have to think smart and be careful. But again, will it take a super spreader event? Will it take an NFL team to be decimated with 30% of their players sick? Even if, there's no mortality, but you can't play a game or something. Or will it take a Tom Brady getting sick or a Kevin Durant or somebody that's really a major player? We've mentioned this before. Will it take a dangerous situation for people to go, you know what? That's a financial decision. I'm losing Tom Brady. I'm losing Kevin Durant. I'm losing Steph Curry. I need to rethink this, right? I need to protect my assets. It's also something for businesses and organizations to consider worst case scenarios and kind of protect themselves. So we'll see kind of how it plays out. I just say continue to be careful, be smart, get vaccinated unless you have a medical reason not to. And if you do have a medical reason, mask up and be careful if you move forward.
My thing would be is that the NFL, all our sports leagues, they always take pride in saying that, we have young kids watching them. Young kids want to emulate being a Kevin Durant or a Tom Brady. We need to bring up this next generation. You need to be a role model to the smaller kids because they're always looking up to you. Well, I think they need to take the point to we are the NFL, we are MLB, we are the NBA, we are the world's leaders in these sports. And we need to take a stand. We need to be role models. We need to show the way of how, how we want to take safety, how we want to take it to another level and make sure that our fans, that our young kids, that these kids that look up to us, that they know to do the right thing. And the right thing is to go out and get vaccinated. But how can you tell them to go out and get vaccinated when you aren't? So to me, the league should take a stand. They should be the ones leading us because they have so many people that admire them, and want to be like them. And I just think if they take a stand, if they show the way, and show that vaccination is a good thing. And I just think it would permeate. I think it would just be the trickle down effect. And I think you would get so many people that would think about it and possibly go out and get vaccinated. So I really hope that these commissioners really think strongly about this and maybe even look at, trying to have these guys go out, even if you have to mandate it or you have to incentivize it, but find the way that you could get your players to get vaccinated so they could be role models for some of these kids, some of these young adults that haven't gone and done it.
Yeah, I couldn't agree more with you that, the role model, the example, as parents, as athletes, as executives, as whatever, right? You never know who's watching. And we all know that if you're a parent, and certainly if you're a supervisor or a leader, that that's true too. So I agree. And I still will go back to what Dr. McNamara mentioned, and I hope we can get to this voluntarily. That's my hope and prayer, that we don't have to do other types of things, that people kind of, again, take a moment and reflect on their place in society and in their family and in their community and try to get past the echo chamber and the noise of it's my right, it's my right, it's my right. That's a dangerous stance when it comes to public health. It's a we, it's not a I.
That's right.
It's really important. We're at a really critical time in our public health trust, a really critical time in the health of the country and the world. And I just really hope, again, that with outlets like yours and others that we can start making those inroads. So again, thank you guys for having both of us on to discuss our article.
Absolutely. Deb, are you able to wrap us up?
I'm not sure if I'm able to wrap us up or not. My computer completely froze. Welcome to technology.
But we hear you very well. So go ahead and wrap us up, Deb.
Okay. Well, thank you, everybody, for listening. Thank you for joining us, Dr. Rohde. Thank you, Dr. McNamara, who may or may not still be listening to this. And Lomas, it was, as always, great to talk with you. I think we have really covered COVID, and all I can say is I really, really hope everybody goes out and rethinks that vaccination status. Because, again, it's not just us. It's not just you. It's your family, your friends, your loved ones, people in the workforce. So thank you, everybody. Thank you, our listeners. Check us out on SportsSlaw.com. Check us out on Spotify, on iTunes. And we'll look forward to our next episode.
Goodbye, everyone.